Welcome to the webinar on the right to health during the COVID-19 response in Uganda. And we're going to have a deeper discussion today on the implications of the national response. I am Solomon Nakawesi. I am your moderator for the next 2 hours. And I am honored to moderate a panel of accomplished Ugandans, Africans, and international human rights activists and medical practitioners. On my panel today, we have a keynote speaker who is none other than Professor Ben Binomugisha from the School of Law, Makerere University. And for those of us that would like to know more about Professor Ben, he's going to tell us who he is in a minute after I do the introductory session. Then we have a panel of 4 people. And we have Rose Wachikona from the Center of Health, Human Rights and Development, CEHAD. We have Professor Peter Waiswa from the School of Public Health, Makerere University. We have Professor Sarah Sali from the School of Women and Gender Studies, Makerere University. And lastly, Professor Segane Musisi from the Department of Psychiatry, School of Medicine, Makerere University. This panel is going to enable us look at a cross range of issues. From one point, we're going to really look at the response and the realization on the right to health. And Professor Ben is going to take us through that. And then Rose from the CEHAD is going to enable us really look at safeguarding the rights of frontline health care workers, because they're at the center of managing this crisis. And like we all know at this point in time, we realize how important our healthcare providers are nationally, regionally, and internationally. And then Professor Waiswa is going to enable us deconstruct and look at reproductive health, maternal health, newborn, child health, and adolescent health. Because like we all know, health issues still continue amidst this pandemic that are beyond COVID-19. Professor Sarah Sali is going to look at the gender dynamics of COVID-19. Anything in life has a gender lens, and we're going to have the conversations there. And lastly, Professor Segane is going to enable us to look at COVID-19 and the impact on mental health. Thereafter, I know we'll be warm enough to get into a question and answer session. And after that, we're going to summarize. And due to time, we're going to close this webinar. And then we'll direct you to where you can get further information, because this webinar has been organized in a way where we have a total of 5 technical briefing papers that the panelists have prepared. But before we get into that, I'd like to invite the hosts to tell us the housekeeping rules, what will enable us to enjoy this webinar, but also how do we manage ourselves, because there's so many of us and you're in different time zones, as well as different locations across the continent and across the globe. Welcome on board, and we look forward to having a great time with you. Grace, please tell us the housekeeping rules.
Thank you, Salome. Welcome, everyone. We are honored to have you here. So a few housekeeping rules. You'll notice all your mics and video are off. That is so that we don't have any interruptions during the session. During the Q&A session, we will raise our hands, and when the moderator picks on you, your mic will be unmuted. You will receive a prompt asking you to accept that your mic should be unmuted. Please accept. If you don't accept, then we will not be able to hear you. Please also take advantage of the Q&A section, which is in the same place where your mute, start video, and chat section is. You can start asking your questions even as the panelists are presenting. In case you get disconnected from Zoom, we are also live streaming the session on the Center for Health, Human Rights and Development Facebook page. So you can join us there if Zoom is disturbing you. We shall also be taking your questions on that Facebook page. Otherwise, we hope you will enjoy the session and that it will be productive for you.
Thank you very much, Grace. I'd like now to take an opportunity to invite Professor Ben Mugisha to tell us who he is and what he does.
Thank you, Salome. You hear me?
Yes, we can hear you loud and clear.
Oh, very good. Thank you, Salome, my colleagues and the organizers. I am Ben Mugisha. I teach law at Makerere University, and I also assist in some kind of work with Sehud. I'm glad to be here in the chat room. Thank you.
Thank you very much, Professor Ben. And Professor Ben is going to be our keynote speaker, but before he starts the keynote speech, I'd like to invite the panelists to introduce who they are and what they do. We'll start with Rose.
Good morning, everyone. Yeah, my name is Rose Wachkona. I am a senior program officer with the Center for Health, Human Rights and Development, which is also CEHAD, and I'm very glad to be here. I work with the Strategic Litigation Program.
Welcome, Rose. Professor Waiswa.
Good morning, everybody. My name is Peter Waiswa. I'm an associate professor at Makerere University, School of Public Health, College of Health Sciences, and I run actually maternal newborn child center of excellence. Recently, I was honored to be actually appointed by the Director General of WHO to be one of the advisors on reproductive maternal newborn child health, including these issues of COVID. Thank you.
Thank you, Professor. Now go to Professor Sarah.
Good morning, everyone.
Good morning.
I'm Sarah Sally. I'm an associate professor of gender studies. I am the dean of the School of Women and Gender Studies in Makerere University, and also the director, the Center of Excellence in Notions of Identity, which belongs to the African Research Universities Alliance. Thank you.
Okay, thank you. Lastly, Professor Segane. Professor Segane, are you there?
Have you heard what I said?
No, we've not heard.
I said that I'm Professor Segane Msisi, Professor of Psychiatry at Makerere University, School of Medicine, College of Health Sciences. Do you hear me now?
Yes, very clearly. You're welcome, Professor Segane.
Thank you.
And I'd like to welcome our participants. I know there's so many webinars that are happening at the moment. I know there's so much that is happening, but the fact that you've joined us shows how committed you are, how interested you are, but also how far you're looking for, if there are any answers to some of the questions that you have. And today, our webinar is going to assess the impact of the COVID-19 national response on the realization on the right to health in Uganda, and also suggest mitigating measures. It has been organized by the Joint Advocacy Program on SRHR that they call JAS program, which is a partnership of 7 organizations working at the national and regional level. Akina Mama wa Africa, Human Rights Awareness and Promotion Forum, the Coalition of Health Promotion and Social Development, HEPS, the National Forum of People Living with HIV and AIDS, Networks in Uganda, NAFOPANU, Reach a Hand Uganda, RAHU, Uganda Network of Sex Work-Led Organizations, UNESCO, and the Center for Health, Human Rights, and Development, CEHAD. And this program is really aimed at garnering collective effort on sexual and reproductive health and rights movement building and organizing in Uganda, and is funded by SIDA. So I'd like to thank the conveners of this particular webinar, as well as the partner SIDA who is supporting the webinar. So at this point in time, we are dying and ready to get into the gist of the conversation. Professor Ben, please start us off with your keynote on the response and the realization of the right to health. You're welcome to this. Professor Ben, are you there?
Do you hear me now?
Yes, we can hear you now.
I'm sorry, I had not unmuted my microphone. I'm very sorry. So I was saying that the topic of my presentation today is COVID-19 response and the realization of the right to health in Uganda. As we know, COVID-19 is a topical issue. And I observe that's a public health, gender, human rights issue. And when I talk about public health, I even include questions of mental health. And I'm glad the panelists, Professor Segane, Professor Waiswa, and Professor Sali, joined by Wachukona on health workers, are going to touch upon these issues. So the presentation tries to address three important questions. What are implications of COVID-19 response to the right to health in Uganda? Second, how should government of Uganda ensure that COVID-19 response does not undermine the realization of the right to health? And thirdly, what role should civil society organizations play in the struggle to realize the right to health amidst the COVID-19 response? The paper or the brief is a bit detailed. It has a section that tries to tease out the normative content and scope of the right to health at the international, regional, and domestic levels in our constitution. I will not go so much into that detail, but suffice to note that Uganda is a party to international, regional, human rights instruments that recognize the right, and that the Ugandan constitution has provisions with a strong bearing on this right. And these instruments also point to the obligations of Uganda. And in addition to the international human rights that we are used to, the WHO in 2005 developed international health guidelines on epidemics, pandemics, endemics, etc., which within the public health and human rights realms, we refer to those regulations. And a second point here is that these instruments move beyond healthcare as a right, and they also encompass social determinants of health, issues like environmental matters, gender, poverty, and others that implicate the right to health. So with that brief presentation on the right to health, I go into what the obligations of government are, and basically they are to respect, protect, and fulfill the right. For the non-lawyers, but this is also very critical, there's what we call an obligation to progressively realize the right to health according to the available resources for a particular country. But within this right to health arrangement, there are a number of obligations which we call core. That is, they are so important that even in a state of emergency, a government should ensure that minimum levels of these, the right health are realized. And these include the right of access to healthcare services and goods, commodities, access to minimum essential food. You know, we've been hearing about people who are moving to healthcare centers during curfew and they are stopped on the way. Essential food, that's why government is coming in, basic shelter, essential drugs, maternal and child care. You've been hearing of women who are in labor in urgent need of care, and some of at times whose labor is obstructed and they need emergency obstetric care, and at times they don't have permits and they have to move. So we are saying these type of rights are so critical, and especially for the vulnerable and the poor, that whether day or night, these rights must be realized. The question of labor and delivery care does not know class. The woman who is into that, even the one who has, for example, an ectopic pregnancy, they need that type of emergency care. And another key core obligation is to take measures to prevent, treat, and control epidemic or endemic or pandemic cases, as we have COVID-19, as I indicated in the brief. The WHO recognized it or declared it as a pandemic. Quickly move to the implications of government response. And we know the response. I will not go into detail. It's in the brief. Quarantine. I used to call it quarantine, like using a Ruchiga word, but I've heard from the Minister of Health it's pronounced as quarantine. Quarantine and isolation, lockdown, including curfew. We are living this. We are part of it. I will not go into detail, but when you go the brief, you'll see what the WHO has elucidated on what these concepts mean in the context of tackling the pandemic. So the COVID response point I have to make first is that on this response, indeed, government has done its best. And in the brief, I say the response was designed and implemented in good faith. And the government is trying to do its best. The president, the minister of health, and her technical team, the prime minister, they are trying to do their best. But inevitably, through what we call the public health and human rights framework, where public health and human rights are supposed to be mutually reinforcing and complementary, you'll find that certain measures taken within the realm of public health inevitably impact on human rights adversely or in a negative fashion. And that's what we are going to see later. So what should government do? My first observation is that we need to understand the normative scope, or what we call limitation of rights. Our constitution was shaped in such a way that Chapter 4 outlines rights and freedoms which the government, agencies, and even private persons are supposed to observe, including the right to life, even right to health in some of the provisions in the objectives of the Constitution. But these rights under Article 43 of our Constitution, building on the United Nations Saracusa principles on restriction of rights, these rights can be limited. These rights, including the right to health, including assembly, association, worship, movement, can be limited on two grounds: one, for the protection of public health, and secondly, for protection of the rights of others. And protection of public health is what the state is doing now to protect us from this pandemic. But I'm saying in doing this, government will ensure that they observe those conditions which I put forward in the paper, to ensure that they do not burden the rights in a disproportionate manner. Secondly, government should ensure that the core obligations which I have listed above, in terms of the right to health, including access to essential emergency health care and nutrition, people shouldn't starve. They should ensure that those obligations are met. Government, I say, should mobilize and deploy resources, both internally and externally, whether it is financial, physical, or even human resource. And this is very critical. Later, I'll talk about the protection of health workers to ensure that they are motivated, they have protective gear, and they have working equipment. Government should ensure participation of the citizens, including health workers, into this response. It should take steps to combat stigma and discrimination against the patients, whether within the quarantine places, isolation centers, or when they are discharged and released to the communities, because stigma and discrimination can be very challenging. And I'm even saying they should continue to ensure periodic review of the response, and I'm happy the government is doing that, so that you see whether it is 2-3 weeks, then the government should come up and say, is it time now to lift, basing on scientific evidence, not through pressure, and not through unscientific means like what we are hearing from Tanzania. Observe ethics. Here I talk about two things: questions of data protection. We have a law now on data protection and confidentiality, and the international health regulations emphasize this. Support, I think I said, and I protect health workers, and the brief I emphasized in the full scale paper, but that one was cut out in the brief. These people also have children, they have families. When they are in the workplaces, quarantined there, they are also quarantined. I'm using it in quotation marks because they are not allowed to move out, most of them. Then their family should be taken care of.
Professor Ben, we can't hear you. Professor, are you there? Professor, are you there? It seems we've lost Professor Ben. Give us a minute or so to get him back on. Professor, are you there?
I think we lost him. Maybe we can continue with others, then he can come back.
Okay. So what we can do is to beg your indulgence as the webinar participants and attendees, and those that are streaming on our various social media platforms. The professor will get back on, and we'll get back on. But in the meantime, I'll ask Rose to step in and share with us about frontline healthcare providers. And then Professor will get back on.
Thank you so much, Salome. I am very happy to be here. to present on a technical brief that we developed as a strategic litigation team. The paper we was specifically looking at the rights of people who are at the front line of the fight. Again, another thing for us to take all measures possible in order to protect them against any risk that may come from them working at the front line. So we all know that workers are at the front line of the fight against COVID-19, that have been elected of prioritization for information on how to combat COVID-19, but also in the procurement of
Yes, we can't hear you clearly.
equipment.
Hello?
Yes.
The things that are
Hello. Can I request Rose to get off now? But we can't hear you. Rose, can you please get off the unmute? Okay. Are we doing good now? Professor, are you back? Rose's network is also a bit jumpy. Professor, if you're back, Professor Ben, can we continue with your presentation as we are sorting out Rose's network?
Hello?
Yes, we can hear you loud and clear.
You can hear me now?
Yes, sorry we lost you.
No, there was a challenge. You can hear me. I don't know even how far I was talking, thinking that you are following. I don't know even how far I had gone. Whether you were following me.
Yes, Prof.
Can I try to bring you on board?
Yes, sure, please.
Did you hear when I was talking about limitation of rights, seeing that it's allowed?
Yes. Yes, that is where you stopped. When you stopped
where
where
I
you're
stopped.
starting limitation of rights, yes.
Yes, when I say limitation of rights are permissible. Hello?
Yes, that's where you stopped.
Okay. And then I was saying that the government response to COVID-19 is permitted by the Constitution, which allows the limitation of rights, including the right to rest, on grounds of protection of public interest, including public health, and safeguarding the rights of others. And I was saying that the obligations which I talked about, like ensuring access to medicines, ensuring that people have access to health care, including emergency care, are provided. And I was saying government should mobilize both local and international resources in this era of the response, insofar as realizing some of these components of right are concerned. And I said we should also ensure participation of citizens, including health workers and all affected people in this response. And it should ensure free flow of information, ensure that the information that is provided is scientific, based on scientific evidence, based on research, and they should not cook up any information, and I believe they are doing it well now. And steps should be taken to combat stigma and discrimination, including during within the quarantine and isolation places, or even after these people have been discharged, when they go to the communities, so they are not discriminated against. and should also ensure, are we still together? Hello? Hello?
We can hear you.
We can hear you.
Okay.
We can hear you.
I'm sorry, I have to continue. Okay. Then the government should ensure a periodic review of the response, because this response must not be there for forever. But I'm saying the review should be based on scientific evidence, so that we do not have to rely on conjecture and just guesswork like we are seeing in Tanzania, where I suspect, I'm sorry to say this, that there is some kind of manipulation of data and even intimidation of laboratory human resources. So the data that should be released should be able to inform the periodic review response, and I'm happy the government is periodically informing us of this. We need to observe ethics. Government should need to observe ethics. Minister of Health in terms of data and confidentiality, because we have a data protection law, ethical requirements on confidentiality, support, and even this question of ethics should, when we come to vaccines, when they come to trials or even drugs, the ethics of research, as per the National Council of Science and Technology guidelines on researching on human subjects, they should ensure that the institutional review ethics committees handle this question. Then government should not politicize the fight against the pandemic. We should ensure that all of us are in it, whether political parties, religious leaders, pressure groups. And I was happy when the president welcomed the donation from the Bobby Wine pressure group, although tongue in cheek. But we should ensure that there is partnership between government and other key stakeholders, including civil society organizations, in handling this. So they actively involve the private sector in the fight, and I'm happy about the donations that are coming up, but we should ensure that these resources are utilized for the purpose of responding to the COVID-19, including provision of food. Although I saw what Kiza Besige posted, I think there is also need to have messages touching the nutritional aspect of the response, what people should eat to boost their immunity in terms of ages, including the elderly, etc. Hold all agencies involved in the COVID-19 accountable, especially where human rights are violated beyond what is acceptable by our constitution. We have heard of cases of torture, cases of people denied care even when evidently someone, for example, is seen as pregnant or very sick. So the state of emergency, people have been debating that maybe the government should declare a state of emergency under Article 46 and 110 of the Constitution. My view is that the state of emergency, given our fragile democracy, should be the last resort, because you are likely to have gross violations of rights when there's that kind of state emergency and people may not be held accountable. I rush now to the role of the civil society organizations, and I expect a lot of contribution from this. I'd say, in my view, civil society organizations should not twiddle their thumbs, should not simply sit back and say, since there is a response, we should sit back. The first point of engagement would be to lobby and engage authorities to place civil society organizations in the category of essential services, so that they are issued, say, with special permits to essential staff, so that they are able to reach vulnerable individuals and communities. In the brief, I go into detail. Civil society organizations should be proactive and innovative. They should inform and consult the Ministry of Health on measures to be taken, and engage certain companies, private companies, or even individuals, companies like Jumia, they deliver some essential products. For example, if you are delivering morphine, somebody, it's a cancer patient, terminally ill patient, someone has, you have heard from the grassroots or some place that somebody has had an unsafe abortion, maybe you want to assist in some way. So with some kind of post-abortion care, you want to send some antibiotics somewhere. How can you handle that? We need to be innovative. Then jointly cooperate to look out for emergency cases. You can have organizations cooperating both at the macro and micro level, the grassroots, and document violations of rights during this period, so that after COVID, we can take steps, whether through litigation or other means, for purpose of holding whether they are government or non-governmental actors accountable for violations. Then hold virtual meetings as we are doing, I think that is clear. And ladies and gentlemen, by way of conclusion, I'm of the view that the COVID response can adversely affect human rights, including the right to health. But what government is doing is a move in the right direction to protect public health, including key aspects of right to health, and limitation of rights, including right to health, are permissible. And the government should ensure that co-obligations, like that question of nutrition, essential service, essential medicines, maternal and child care, etc., basic shelter, like